This module is about assessing the P in PACE, which stands for physical. It's about helping you determine a client's current physical abilities and the steps to take when abilities are diminished. The process starts with a mini assessment. It's important to note, this is not meant to replace an assessment by a PT or OT. It can be completed by any healthcare worker. In this scenario, the client is lying in bed. The assessment involves prompting and cueing the client through basic movements. The PACE communication assessment should have already taken place before you start, as it is vital when cueing the client. To start, determine if the client can roll onto their side in the bed. Then, if they can rise and sit upright on the edge of the bed, and then balance with their hands on their lap. From there, can they stand and bear their own weight? Can they initiate a step? Are they stable and steady when walking? If yes, then the client is independent, and it is okay to proceed with the desired task. In certain cases, the client may require minimal assistance with bed repositioning, sitting, standing, or walking. Minimal assistance means you are applying less than 35 pounds of lifting force to complete the desired task. It's helpful to remember that 35 pounds is the average weight of a human leg. If less than 35 pounds of force is required, then you may proceed with caution. If assisting a client requires more than 35 pounds of lifting force, you should stop and get assistance. At certain times, the assistance of a fellow healthcare worker may be enough to help the client complete the task. In some cases, however, mechanical lifts and slings may be required. If you require the use of a mechanical lift, you'll need 2 people to operate it, and you'll also need to choose the appropriate sling. Sling Choice should take into consideration the task required, the client's skin integrity, and overall comforts. You should consult PACE's Sling Resources to help ensure you are making the right choice. These are located in the healthcare section of the Work Safe for Life website. Some common slings include the universal sling, used for clients with limited upper body mobility, and the hammock sling, which is the most supportive. For toilet functions, you should use a hygiene sling, which is the least supportive. There are also band slings, which are used to lift and support individual limbs. Remember to inspect slings before each use, looking for signs of wear and tear and recording any issues. For repositioning tasks, which may be repetitive, you will require a mechanical lift and sling for any situation that requires more than 35 pounds of force or if the client is bariatric. For less than 35 pounds of force and a client who is not bariatric, friction pads or slider sheets can be used for repositioning. A soaker pad should not be used for repositioning. If a soaker pad is required, it should be placed on top of the friction pad or slider sheets. That concludes the physical portion of PACE. By using PACE to assess a client's physical capabilities, you will help ensure clients get the care they need and you stay free of injury while caring for them.